Patients, they really love that we put labels on their problem. Yeah, they come to you with some kind of musculoskeletal problem. Perhaps they have some data from medical imaging or other exams, and they expect from us that we put a label on it, that that's the problem, there is a problem, and that's what we're going to do about it. And many people expect that. But the reality is a little bit different, as we all know. Yeah? First of all, labeling a problem in musculoskeletal medicine is not always easy. In some kind of cases, with some pathologies in the extremities, yeah, we can put a nice label on it. But when you talk about the spine, then it becomes a little bit more difficult, because most of those complaints are very specific, and the data obtained from medical imaging, they are also not very reliable. But nevertheless, the patient wants us to put a label on it. I wish I could reach a very nice, clear, useful diagnosis during the first visit of the patient. And yeah, sometimes we can do that. But in some other occasions, it's not possible. And then the question is, how do we solve that? Yeah? How do we deal with this? After all, we are not magicians. Yeah? I think some colleagues believe that they are magicians, but they have certain talents I certainly don't have. But okay. So, if a certain problem is not clear during the first visit of the patient, what can we do? First of all, we have to retest several times. If you have a kind of functional examination test procedure, do it several times. Do it also in other time frames. Yeah, do it on other occasions. Yeah? There is no rule that says you must reach a valid diagnosis during the first visit. No. Okay, I'm going to retest several times on several occasions, and then I'm going to see what happens. What are the main elements which are clear, and what are the, let's say, I call that the disturbance factors. Yeah, some tests which are positive now and negative then, and positive again, and then they're negative again. So you cannot very much rely on that. So, test several times, test on multiple occasions. Another thing, perhaps it's possible that the patient's problem is multiple. There's not just one problem, there are several problems. And perhaps I don't understand everything. So focus on what you understand and leave alone what you don't understand at this point. If a certain lesion, if a certain pathology is clear today, then you can start focusing your treatment on this first aspect, and then you see what happens. And then later on you retest, and then you can interpret, okay, was there some kind of positive evolution, yes or no? For instance, that happens a lot with shoulder patients. Yeah? Let's say a shoulder patient with a nice, beautiful acute arthritis. Well, it's quite possible that you also find some positive resisted tests in your functional examination, theoretically pointing in the direction of some kind of tendinopathy, but in fact they don't have a tendinopathy. The arthritis is the main factor. So don't kill your patient with, let's say, don't shoot with an elephant to kill mice, so to speak, but try to analyze different patterns in a, let's say, logical sequence. Another hint is, if you have doubts, is it more this kind of problem, or is it more another kind of problem, then always focus first on the most common problem, yeah? The thing which is most obvious. And then most likely you're going to see when you're treating, let's say, the most common problem, and you retest in the future, then you see that the so-called less common problem or rare pathology, well, that it is also a kind of disturbance transmitter. So orthopedic medicine, musculoskeletal medicine, is absolutely not an exact science. It's a challenge. Yeah? On the one hand we have the anatomy, on the other hand we have the brain. Yeah? So don't worry if during the first visit it's not 100% clear for you. It also happens with me and so many other colleagues. But try to incorporate those little tips and tricks, and then you're going to come one step closer to a more efficient diagnosis. So if you want to find out more about the diagnostic aspect in musculoskeletal medicine, clinical reasoning and so on, then I'm happy to refer you to our live and online courses in orthopedic medicine, and to some other online resources I put at your disposal. So now I'm going to enjoy further the afternoon here under my tree in the garden. Beautiful day. And I hope that you can reach a lot of success in musculoskeletal medicine. So enjoy your day. See you on the next occasion. Bye bye.